Hello, I'm Dr. Mazhar Hussain from My Hair Clinic. If you are having a hair transplant, you'd naturally wonder what to expect after the surgery. I'll give you an outline, but it's a very general outline. There's a huge difference in how patients will have their results, when they will have their results, and how the post-op period will work. This outline may apply for maybe 70 to 80% of patients, but other patients may totally differ from this general guideline I'm giving here. Some patients have visible results even in 4 to 6 months, while others might start getting some results at 10 to 12 months. So this just goes to show how big a difference there can be from patient to patient. During the surgery and following days after the surgery, you may experience swelling. That's quite common. Usually it's light swelling from your forehead, goes further down around the eyes, further down with gravity, and it goes away in 2, 3, 4 days. 5 to 7% of patients may have severe swelling. It can start from the forehead, go down around the eyes, around the lower part of the face, and then it goes away. It's not dangerous, and in those cases with severe swelling, it may last 7 to 8 days. If you have severe swelling and fever, or if it's very red, or if it's sore to touch, it could be an indication you are having an infection. And in that case, you need to speak to a doctor. But swelling alone does not really count as anything that is totally unexpected. And there is no reason to take any medical treatment for that. Very few patients have infections after this surgery with our clinic. Since 2004, you've had 14 patients with an infection they've reported back to us. Anyhow, if you have an infection, let us know or speak to your primary care doctor. Pain after the surgery. You may experience pain after the surgery. It's not very common, but it does occur. In many cases, paracetamol is enough. Some patients may need NSAIDs, non-steroidal anti-inflammatory drugs such as ibuprofen, diclofenac, and naproxen. You shouldn't normally need anything stronger than that. During the first 12 weeks after the surgery, your hair may shed. And of course, a lot of patients are concerned about that. But it's a natural part of the process. The follicles undergo kind of a shock when taken out, placed in a petri dish, and then planted back into the scalp. So if your hair falls within the first 12 weeks, it's nothing to be worried about. Itching can be quite common. Pimples, pop-ups, irritation, dry skin is quite common. You may need to use coconut oil, baby oil, maybe aloe vera, or you might even need some medication if it bothers you too much. Speak to us if you're having any issues. Growth starts from the 4th month and onwards. Usually, pimples, dry skin, and irritation has reduced considerably. Numbness is usually less, but it can still be present. 6 to 8 months after the surgery, numbness is usually gone, and you start seeing visible changes after the surgery. Again, this is a very general guideline. You might not have visible results even at 10 months.